P1 student, it's hard to say just because it's so, that's like, so early on, but it's a 3-year program now, so the time is much shorter. So I also precept the IPPE students on medicine, and it's on the primary coordinator for that medicine series. So I'm meeting them in the summer. So at the end of their P1 year, going to P2 year. So I would say when you kind of, I guess, that's my recommendation is that as you approach IPPEs, you want to kind of take, you want to take advantage of IPPE rotations, as I said, because IPPE rotations are not punitive. I don't know if that's the right word to say, because there's nothing, there's no harm from doing really well or really poorly on that rotation, because it's not going to impact your career. You're not going to fail in a sense, right? But you want to do the best you can, get the most out of it, because when you get to APPEs, that's going to matter. Because then if your interest is, I want to do a residency or I want to do a fellowship, you need to do well in APPEs so that you get a letter of recommendation, right? And so you want to be able to do well. And so you can't do well in APPEs if you come in not having any experience, right? So IPPEs is going to give you the experience. So like you can like fail in IPPEs, but like try to do as much. So you'll prepare when you get to APPEs. Like, I'm not worried about talking to a doctor. I'm not worried about talking to patients because I've done this so much in the IPPE, right? So you're not worried about these kind of basic things that we take for granted, these skills for students. But I have had APPE students, when I asked them, like, hey, you call a pharmacy to check in on a prescription, like, how do I do that? They've never spoken to a retail pharmacy before. Like, well, you finished 3 years of school and you have never spoken to another pharmacist before. It's a little odd. Or I'm gonna say, like, can you go ask a patient a question, a very specific question, right? I barely ever spoke to a patient before. How do I do that? Right? Which it's kind of weird to me, right? But like, now we give all these different experiences for IPPE students. So usually my IPPE students, by the end of the rotations, they like ask them to go cancel a patient. Oh yeah, easy, no problem. It's like they do it so much. So that's not something you're scared about.